Hello everyone, I'm Dr. Sujit Shanshanwal. I'm a consultant dermatologist and medical director at Clinics, Mumbai. Now with this rising heat and the hot humid weather, it is very common for people to suffer from prickly heat, which is that annoying itchy rash that tends to happen. Commonly we see it on our trunk area, on the chest or the back. Today I'll be talking about why does it happen, what is the science behind it, and how we can manage it better. So what is prickly heat and what is the science behind it? Now malaria, not malaria, miliaria. This is commonly known as prickly heat. This is the condition where you see tiny red bumps which are related with itching and the prickling sensation, hence the name prickly heat. Why does it happen? Now our body has millions of sweat glands on our body. The purpose of the sweat glands is to release the sweat which evaporates and gives a cooling effect to our skin. Now because of the humid weather or because of increased excessive sweating, if the production of sweat overpowers the capacity of the duct to drain it, it can get accumulated in the layers of the skin, which can lead to irritation and lead to this prickly heat rash. Why does prickly heat happen more in certain conditions? Now, if you talk about an environment, if you're in a hot, humid weather. Now, this hot, humid weather need not only be outdoors. If you're working in a space which is not well ventilated, or if you're traveling in a crowded environment, basically where there is more heat trapping, which can trigger more sweating, can lead to the prickly heat rash to develop. Apart from that, if you're wearing occlusive clothing, which is interfering with the drainage of the sweat, can also aggravate the chance of you developing the prickly heat rash. Now, what are the various ways in which you may notice these rash on your body? So there are three variants for malaria, for the prickly heat. One is malaria crystallina. As the name suggests, they appear like crystals. You will see tiny fluid-filled blisters, bubbles on the skin. Second is malaria rubra. Rubra stands for red. So you may notice tiny red bumps on your body, on the back of the chest, which is also seen as a version of the prickly heat. The third is malaria profunda. Profunda means profound. So sometimes bigger bumps can also develop and present in this prickly heat issue, which can also be a presentation which is commonly seen. A common question that patients often ask, that why do we see this more on the back or the chest area? Now, you have millions of sweat glands across your entire body, but if you have practically noticed that if you are engaged in sports or whenever you're sweating, you notice the chest area starting to sweat and get wet first. Similarly for the back area as well, before your arms start to get wet or the legs start to get wet. So your chest and the back has a higher density of these sweat glands, because of which these areas are more prone for the patients to develop the prickly heat problem. So let's talk about managing and preventing prickly heat. Rather than managing it, following certain basic precautions which can help prevent it are more advisable. So for patients who have exposure to hot, humid environment or who have a tendency to sweat more, they should be more careful regarding the amount of sweating that they would be exposed to. Using powders which contain Neem and Tulsi are helpful. That's especially because these ingredients have a soothing effect on the skin. They help decrease the inflammation. They also help to control the bacterial activity on a skin surface, because when this sweat accumulation happens in the prickly heat problem, it is the increase in the activity of the bacteria that causes the inflammation to aggravate further. So using a powder, using breathable clothing, cotton clothing, if you are going to be sweating more, taking more frequent showers, these things will be helpful in managing a prickly heat effectively.